Well, a lot of people have moles which they simply don't like because of the visual appearance, whether it's on the face or on their chest and limbs, and so they want to have them removed in order to improve appearance. And the plastic surgical approach to mole removal is obviously designed to minimise the impact of any scarring. The surgery can usually be done under a simple local anaesthetic on an outpatient basis, and in the vast majority of cases those sort of moles are benign, although a number of moles we will send off to the lab to get them checked. Any sort of pigmented lesion that has changed in nature should be sent to the lab and checked histologically to make sure that there's no skin cancer growing. Now, there's a greater awareness of the potential for sun damage to the skin and skin cancers developing, and an important part of plastic surgery is treating those sort of skin growths, removing them, in the majority of cases with a basal cell carcinoma, which is the common sort of sun-induced skin growth. Surgery is curative. Some basal cell carcinomas can be quite difficult to diagnose and to see exactly how far they extend, and here at the Cadogan Clinic we can do pathology on site to check the clearance and to be sure in one stop that the tumour has been fully removed. And that means that we can then proceed to a reconstruction, either by direct closure of the wound as cosmetically as possible, or using a small flap or a skin graft as required. And that's something which can all be done under local anaesthetic, sometimes with sedation as a day case. And other forms of skin cancer, of course, we're very aware of the risk of malignant melanoma, and everyone should be concerned about any change developing in a pigmented lesion, a dark coloured lesion, any change in the regularity or depth of the pigmentation, the extent of the lesion, and that's something which we're very hot on at the Cadogan Clinic. And we have here not just plastic surgeons but dermatologists as well, for a multidisciplinary approach to what is an increasing problem of skin cancer.